Hi, good afternoon. This is Mandy Alvarado, and my social policy agenda building issue is going to be rural community jails and substance use treatment. So, social issue. Incarcerated individuals in local county jails face the injustice of lack of opportunity to be educated on the disease of addiction, identifying the warning signs, triggers, and treating the root of the problem as part of their rehabilitation. Current services are centered in dense populated areas. Bigger cities have opportunities to educate inmates. In rural communities, it's not exactly like that at all. So, social issues continue. The Department of Corrections, TDOC, decision support reports 115 short-term confinement jails in the state of Tennessee. TDOC facilities have housed 23,868 inmates in the month of August alone. That was a total number for the 115 short-term confinements. National Institute on Drug Abuse estimated that 65% of inmates struggle with active substance use disorder, and another 20% had admitted to being under the influence of a substance when a crime was committed. So nothing changes if nothing changes. Right now, our rehabilitation looks like a person breaks the law, they end up getting convicted, they go to jail. If it's a misdemeanor, they're held in a rural county jail and they sit there. So an inmate has 3 meals a day. Depending on the county, they might have 2 meals a day, actually. So there's differences there. They're going to be in a crowded population with people that have broken the law just like they have. The schedule is going to look like we get up and we eat and we hang out in the pod and then we eat again. And we might play some cards, or we might take a shower, or we might call a girlfriend on the phone, or so different situations, right? But no education is going on. The only education that you're going to have in those kinds of confinements are going to be word of mouth. So I'm going to tell you what I've done in the past, and you're going to tell me what you've done in the past. And somewhere in between there, one of us has learned something about how to do something else another time, how to break the law, or how to do this or how to do that. But it's not going to be substance abuse education. It's not going to be coping skills. It's not going to be things that are going to be helping us later on in life, the majority of the time. So the definition of rehabilitation is the action of restoring someone to health or normal life through training and therapy after imprisonment, addiction, or illness. And that's from the dictionary. So rehabilitation has become a concept used to place individuals in a timeout, so to say. However, people will remain the same without education to change the things that are going on. Safety concerns lead society to ignore issues until they are not avoidable. There's a lot of safety concerns with, okay, this person broke the law, we must put them away so that they can't break the law anymore, which is totally understandable. Then we lead to higher recidivism rates if we're not going to educate too. The opioid epidemic, war on drugs, has affected many people, all the way from the president of the United States down to even the next door neighbor. Some of us might have family members or friends that struggle with substance use disorders. So it's everywhere. Without abstinence and treatment to address the root issues with an individual, the person will continue to use substances, continue to surround themselves with others that express addictive behaviors. Addiction is a disease of the mind. It tells a person that you have to have the substance to survive. And because of that, it's a motivator to do whatever it's going to take to get that substance, alcohol or drugs, whatever it might be. And that's where breaking the law comes in, manipulating, writing bad checks, theft, all kinds of stuff. Substance use crisis. The National Survey on Drug Use and Health estimated substance use for individuals aged 12 or older. There's 165.4 million people that used substances. 139.7 million people had drank alcohol, and 58.1 million used tobacco. 35.8 million used illicit drugs, and 20.4 million people met criteria for an SUD from the DSM-5 criteria. Substance use continued. Tennessee Department of Mental Health and Substance Abuse reports prescription opioids and heroin is at an all-time high, resulting in 1,776 Tennesseans that died from drug overdoses in 2018. And that doesn't include any deaths that were alcohol or chronic drug use. That's only from drug overdoses. Nationwide, that number looks more like 70,000 individuals that died due to overdose in 2021. Not in 2021, I'm sorry, in 2018. I apologize. So recidivism rates. 1 out of 5 inmates faced a drug charge. Of those, 456,000 were held for non-violent drug offenses, including possession. So most of those are going to be like low-level misdemeanor charges, possession, paraphernalia, simple things like that. Statewide recidivism rate is more than 46% for all justice-involved individuals, and that goes from misdemeanor to felony. So just a couple of differences there. Substance use leads to the increase of recidivism through violation of probation and parole. And a lot of times it's going to, if you're on supervision, whether it's state or community, it's going to look like a violation from missed appointments or failed drug screens. There could even be new offenses that are happening. So a couple of things to take into consideration with people that are on supervised or unsupervised probation parole. 40 to 60% of individuals are treated for substance use abuse relapse within the first year of being released from incarceration. A person stays incarcerated for some time. Normally, if a person can't be bonded out, it's around 3 months or so. And especially in rural counties when they only go to court so many days out of a month for those kinds of things. So you might be sitting up to 3 months without knowing what's going to happen. If you're under the poverty level and you can't get a bondsman to come and get you out, you can't pay for somebody to come and do it. So you're sitting abstinence, hopefully. There are instances where people do use drugs in jail, and that definitely can happen. So after some time of abstinence, 40 to 60% of individuals go back out and they relapse in the first year. More recidivism. Nationwide recidivism rate with no substance use treatment. So this is going to yield around a 33% recidivism rate after 1 year of release and 67% recidivism rate after 4 years. And again, that's with no substance use treatment at all, no programming. Nationwide recidivism rate with completed substance use treatment yields a 12% recidivism rate after 1 year of release and 37% after 4 years. So there's a big difference there. Tennessee counties that are taking part in the Reentry Success Act in 21 are Franklin County is one of them. And it's at 85% over the last 3 years. So the recidivism rate without alcohol and drug treatment is significantly high. Recidivism rates with completed alcohol and drug treatment within their facilities on a 3-year span. Franklin County has said that they served 85 people and only 10 have returned to incarceration within Franklin County. Knox County reports 19 that have returned out of 72, and South Central Tennessee Workforce Alliance reports 15 people have returned out of 85. So really good odds there. Cost with no intervention. So this is the daily cost for one inmate in a county facility, and the cost ranges due to where the rural county is, how much their land taxes are, how much all the little things cost, right? And they all add up. So low cost, $46 a day. High cost is $76 a day. And that's reported by the Tennessee Department of Corrections. So a yearly cost is just added up, $16,790 on the low end of the spectrum and $27,740 on the high end of the spectrum for just misdemeanors misdemeanor offenders that are being housed in county facilities. The annual budget 2019 to 2020 requested $112 billion for operating purposes from the TDOC. So it's a large amount of money they're requesting in order to operate. So investments and grants. Investments Reentry Success Act was established and cost $20 million a year to fund the program. In return, it's $1.6 million in the first year and $74 million annually over the next 10 years by housing fewer prisoners. So upfront, we're going to spend a little bit more money than we normally would, instituting the programs and salaries and different things that you're going to need, textbooks and giving them pencils and notebooks and things that they can use. All of those things are going to cost upfront. But over time, over the next 10 years, it's going to give back to the community, to families, and it's going to cost our state less money to run our corrections. So for every $1 invested in programming efforts, it returns up to 7 in reduced recidivism. So if we can pay $1 a day and we're going to get up to $7 back, that's a pretty good gamble, in my opinion. Grants that are offered that can help support these programs for substance use education within the rural counties: Office of Justice programs, offender reentry program, which is up to 5 years. The amount was $425,000 to assist in substance abuse and mental health services. Second Chance Act, that one was established in 2008 and has provided $85 million throughout the U.S. and has been able to service quite a few states. So definitely one of the big ones. And there's the templates and all the directions that are online that can help a person file for those. So limited treatment for incarcerated offenders. 10% of offenders had access to self-help groups or peer counseling, and that's within the jails. And this is nationwide. This is not just the rural community. This is all facilities. So 8% had access to a substance use education program. 7% were placed in a residential facility or a unit. 5% received drug-related counseling by a professional. So really low percentages are actually have access to educational purposes or getting to the root of the issue, any kind of support. Rural communities have taken part in the Reentry Success Act. Franklin County, Dyer County, Knox County, and South Central Alliance. So that is a combination of Wayne, Lawrence, Giles, Marshall, Murray, Lewis, Perry, and Hickman counties, with Murray, I believe, being the one that hosts the clients. So they might end up in a different rural county jail, and then they're transported. But it is limited beds. I believe it was between 10 to 12 beds, and that's as many as they could house at a time. So it is a revolving cycle, but out of the 23,000 inmates that were accounted for in August, 10 to 12 really isn't that big of a number. Davidson County Jail provides a 45-day alcohol and drug treatment for male inmates only at the moment. And they call that New Avenues. At one point there was Healing Journeys, and that was for the female population. This is just one level that they had started in 1990, and it's built from there. So you're going to do the 45-day program, and then you can opt into the next level of care, which is a little bit less. And you can do parenting programs and other CBT, DBT modalities that are offered as well. And they also assist with reentry. So evidence-based practices, this is something that these counties are using to make a change. Criminal addictive thinking, drug and alcohol education, moral reclamation therapy, MRT, relapse prevention, anger management, cognitive behavioral programming. These are things that are listed in the grant writing proposal as things that need to be established. And of course, they have to have proof of those when you're doing the grants. However, it's in the list that those things need to be provided. So delivery methods. Some of these are going to be group therapy. Some of them are going to be individual therapy. You're going to do a validated risk and needs assessment. You're going to have support from peer support specialists. And those are people that are in recovery, mental health issues. They're going to be substance abuse recovery themselves. And they're going to have their certificate from the training, peer recovery support training, which is a 40 hours worth of classes and 2 years worth of sobriety, another 75 hours of supervised supervision that qualifies them in wellness recovery action plans and holding groups and dealing with other addicts and alcoholics. So it's a great thing that Tennessee offers. Individualized case plans, being able to have a treatment plan for each individual and seeing the progress in those things. Discharge planning is really important when a client is trying to start something new, to have somewhere to go. It's in a healthy place for them. Mental health services, getting food stamps, being able to reach out and start to connect with other things that are out there that are healthy for them. Evidence-based practices. Why? Why would we choose those? Because they're backed by evidence through case studies, research, documented outcomes. They improve outcomes. They reduce victimization. They improve collaboration. They target resources toward interventions with the greatest return. And we can see in the slides before how recidivism was really affected by the people that did complete programs within the rural county jails. Those little bits can turn into a whole lot over time. So by being educated with evidence-based programs and practices, can really make a difference. Who, what, where? So who is going to back these things? Who's going to be like, okay, this is a great idea. Let's go with it. The stakeholders, right? Legislators. Governor Lee really has a heart for programs and education for rehabilitation. So he is an important party in this. Judges and courts, definitely stakeholders in rural communities, substance use treatment as a way to reinstate probation, person might come in and they might have failed a drug screen, or they might have missed appointments, and they're being violated for that. This is something that can be used as an intervention to, hey, go in, complete this 45-day program, we'll reinstate your probation and go on from there. That gives better odds. One, that person's still being held accountable through probation services, and two, now they have that education to start to grow on. Jails over time are going to have effects of recidivism that can be lessened. So we're going to not only get recidivism down to a smaller number with less taxpayer dollars funding our correctional system, but we're also going to help to keep families together. Stronger, healthier family bonds, becoming a productive member of society. We're going to teach parents how to be parents. We're going to instill and reestablish values, and we're going to help them how to learn how to change the way that they think so that they can change the way that they feel in a healthy way, instead of using drugs and alcohol to cope with the things that are going on. Communities and community leaders. So to reestablish safety, we got to focus on the root of the problem. Putting people in jail and just letting them sit for the amount of time that the law says is justice, that's not focusing on the root of the problem. That's putting it in the corner so nobody sees it for a hot minute and then taking it back out. So by education, we are working with the communities and the community leaders so that safety can be reestablished. Also talking to community leaders. If we're going to go out in the community and we can help with food drives, we can talk to the communities and ask them what they would like. How would they like things to go? What do you think of the Justice Center, of the justice facilities? How do you think they should run? What do you think about education? Getting a census from the community is a really big issue. Because if you have a community that backs these kinds of things, you're going to have a whole lot more power behind it. Discuss how substance use has affected their families. Ask what they want from their justice system. Join the local drug coalition. Begin networking with other communities, agencies, and facilities. Link with community-based sober living and aftercare facilities. Network with mental health providers to offer services in the community for aftercare. A lot of times people are going to go to jail and they might end up becoming stabilized while they're there. They're on their medications. Things are getting better for them, and they have this new normal. The problem is that when they get out, where does that medicine come from? If they don't know how to make a doctor's appointment, or they don't understand, well, who do I call? Well, what do I do if I need this? And there's definitely situations out there that are like that. If we can get case managers involved with coming in and helping these inmates to set up aftercare planning to go along with their substance abuse education, we're building that stair step up for them to be successful. Lincoln community-based sober living and aftercare facilities, we're educating them on substance use and getting them involved in these programs. Why not get them involved with the community as well, and sober living, where other people like them are trying to overcome these struggles they have with addictions. So, opioid crisis is taking lives from families and individuals. Daily overdoses stress on families, relationships, children being placed in foster care. Addiction creates generational effects. So we already talked about overdoses. This is a real thing, especially right now with the fentanyl. It's a lot. So, and we said 1,776,000. So, no, 1,776 people overdosed, and that didn't count alcohol and chronic drug use. So still a huge number though. Stress on families. When a person struggles with addiction, it's going to put stress on the family. They want to enable that person, and a lot of times that's not the best idea. Definite stress on families. There's a lot of times addicts and alcoholics are going to harm relationships with their family members without really needing to do those things. Children being placed in foster care. So a lot of times other stress is going to be children that are placed in foster care, children that are placed in other families' homes. So not only are we damaging and placing our children at a higher risk for adverse childhood experiences, we're also putting another strain on government resources, because now not only are we paying for that parent to be in the correctional facility, we're paying for that child to be in foster care. So addiction creates generational effects. Legislative powers, taking notice of issues and passing bills for assistance. Definitely think that the time is now, and that's one of the positives, is that Governor Lee is really down for recidivism rates to be lowered and education to be instilled in inmates. So it takes time becoming established with the housing facility. Being able to go in and set up is not going to take a day. It's going to be making those links in the community, making sure that all of your I's are dotted and your T's are crossed, as far as all these things go, because these are people and they need our attention, and those grants need our attention. So being able to cross off all of those things that are needed for those things, it's really important, and it takes time. Waiting through the process of grant approvals is also time costly. So waiting for somebody to say yes or no. Implementing change, positives and negatives. So it's a lot to go into a situation brand new and implement 6 hours of group Monday through Friday, incorporating EBT. So you're going to have people that are trained in these situations, where not only are they trained in how to handle certain crisis situations, they're also trained on criminal thinking issues. They're trained through education of 12-step recovery groups, and volunteers are going to bring those in. So being able to communicate with them so that those things can be offered through the volunteers, and those links can be made for aftercare services as well, because we always want addicts and alcoholics to do their 12-step recovery, or whichever recovery method they choose, refuge, smart recovery. There's an abundance of programs, but definitely getting into something that can keep you going. Parenting education, job skills education, focusing on a reward system instead of a punishment system. And sometimes it's a little hard to do, just because everybody is so used to being punished. So emotional regulation, those are definitely going to be positive and negative within the pod. So not just establishing the program, which is going to be difficult, especially if there's someone in the community that is against programming, but also once it is established, being able to go in there and start all of these things up. So, and make sure a program is ran fair, firm, and consistent. You want to have counselors and people that are in charge to really take hold of this. So they have boundaries, and people like boundaries. Instructors are trained in CBD modalities, also DBT, other things that are going to be super helpful with the education portion. Peer recovery specialists are utilized, and again, their wellness recovery action plans. So RAP plans are really important in stage support. Being able to have someone that has overcome and share their experience, strength, and hope in a professional way is important. Employ a licensed alcohol and drug counselor. This is someone that has studied to become a LADAC and has extensive knowledge of what those things encounter when you're dealing with another alcoholic. So case management services, again, assistance with reentry, assistance with other things that might be needed. So implementing change, positive and negatives a little bit more. So challenges that might come up are lack of interest, and that's from prospective clients. It's from the community. It's from jail employees. It's from the sheriff, the mayor, all of the ones. Lack of technology, finding a program that works for that, for those people that are in need of that system, right? So it could be like record keeping, BPSs, assessments, different screening things, lack of funding. If you can't get a grant, if you can't get the program added into the annual budget, it's not going to happen. Lack of commitment to the program for workers and for clients. You might have somebody that's gung ho when you get in there, but then they're like, nah, this is not for me. So being able to keep people that are willing to work in these environments is a big deal. High stress, definitely. Lack of support, lack of structure, overconfidence, and that goes for clients and workers as well. Lack of attention to detail. A lot of times there's programs that start up and there's something small, that something small builds up until it falls. So definite attention to detail, making sure that all of those small things are added up. Lack of need for programs after some time. Hopefully there is a lack of need for programs after some time, and recidivism rates really do lower due to education that's been offered within the jails. So effects of implementing changes and adding substance use treatment. So it's going to reduce recidivism. It's going to save money by investing in a program with evidence-based statistical information, reducing recidivism by utilizing a small 45-day program where someone's going to come in and teach someone a different way to live. Of course, it's up to that client if they choose to do that. They choose to use the skills, but statistically speaking, alcoholics and addicts are going to relapse around 7 times before they get substantial sobriety time. And that's okay. It's planting the seed. If a person gets sentenced, right, they go to jail and they go up for court and the judge is like, no, you're going to do this 45-day program. Even if they don't want to, it puts in their head that there's something else out there. And the next time they use, it's still in there. So that's where you grow. All right, they did it one time. Let's try it again. And having patience with those things. A person does not want to change. They might be there. Contemplation, pre-contemplation, a little bit back and forth. Implementing a program that is funded, manned. Of course, we already talked about those things as well. And here are the references. I'd also like to add that funding is hard if someone doesn't have insurance and they're not able to attend treatment due to lack of funding, due to lack of knowledge of grants that are available to them. There's a lot of instances where people end up dying because they can't get treatment. And if addicts and alcoholics are going to face institutions, jails, and death, why not? Why not use those things for the better and teach them how to live a life where they can be productive? Nothing changes if nothing changes. We can institute it and start somewhere. And rural county jails is definitely an area where things are needed. Lower poverty areas definitely have a high number of alcoholism and substance use. So getting to those areas and finding opportunities within the jail to come in and supply education so that people can change. It's a big deal. So, thanks for letting me share.